Image 1. The vertebral column. Vertebral column overview. The vertebral column, or spine, extends from the skull to the pelvis and provides major axial support. It protects the spinal cord and allows nerves to exit to the rest of the body. Sections of the spine. Cervical curvature. The first 7 vertebrae, which form a concave curvature. These vertebrae are in the neck region and support the head. Thoracic curvature. The next 12 vertebrae, which form a convex curvature. They articulate with the ribs and are part of the upper and mid-back. Lumbar curvature. The lower back region contains 5 vertebrae forming a concave curve. These are the largest vertebrae and support much of the body's weight. Sacral and cocheeks. The sacrum consists of 5 fused vertebrae forming a convex curve, and the cocheeks is made up of 4 fused vertebrae at the base of the spine. Intervertebral discs. These are fibrocartilaginous cushions between vertebrae that absorb shock and allow flexibility. The center of each disc is called the nucleus pulposus, surrounded by a tough ring of collagen called the annulus fibrosus. Degenerative conditions. As we age, the intervertebral discs lose water content, making them less flexible and prone to injury, such as herniated discs, where the nucleus pulposus leaks out and can compress spinal nerves. Abnormal spinal curvatures. Scoliosis, lateral curvature of the spine. Kyphosis, excessive outward curvature of the thoracic spine, leading to a hunchback appearance. Lordosis, excessive inward curvature of the lumbar spine. Image 2. Paranasal sinuses and hyoid bone. Paranasal sinuses. These are air-filled cavities within the bones surrounding the nasal cavity. There are 4 main sinuses. Frontal sinus, located in the frontal bone, just above the eyes. Ethmoidal sinuses, located between the eyes. Sphenoidal sinus, located deeper in the skull, behind the ethmoid. Maxillary sinus, the largest, found in the cheekbones. These sinuses help lighten the weight of the skull and play a role in voice resonance. Infections in these sinuses can lead to sinusitis, causing pain and pressure. Hyoid bone, a U-shaped bone in the throat, located above the larynx. It's unique because it doesn't articulate with any other bones. It provides an anchor point for muscles in the neck and tongue and plays a role in swallowing and speech. Image 3. Skull bones. Skull bones. This image shows the anterior view of the skull, highlighting several key bones. Frontal bone forms the forehead. Parietal bones form the sides and roof of the cranium. Sphenoid bone, a wedge-like bone situated at the base of the skull. Temporal bones, located at the sides of the skull, near the temples. Zygomatic bone, also called the cheekbone. Maxilla, the upper jawbone. These bones protect the brain and form the facial structure. Most of these bones are fused together by sutures, which are immovable joints. Image 4. The skull and sutures. Sutures. These are immovable joints where the bones of the skull are fused together. There are several key sutures. Sagittal suture, between the 2 parietal bones. Coronal suture, between the frontal and parietal bones. Lambdoid suture, between the parietal bones and occipital bone at the back of the skull. Squamous suture, between the parietal and temporal bones. Facial bones. The face is made up of 14 bones, with the mandible and vomer being the only single bones. The other facial bones are paired. Image 5. The axial skeleton. Axial skeleton, composed of the skull, vertebral column, and thoracic cage. The axial skeleton supports and protects the brain, spinal cord, and organs in the thoracic cavity. Pre-lab quiz. Tests understanding of the axial skeleton. Key points to know. The thoracic cage protects the organs of the thoracic cavity. 8 bones make up the cranium, and they protect the brain. The sternum is composed of 3 parts: manubrium, body, and xiphoid process. Image 6. Structure of a typical vertebra. Typical vertebra. Each vertebra has several key components. Body, the weight-bearing part of the vertebra. Vertebral arch, protects the spinal cord. Spinous and transverse processes serve as attachment points for muscles and ligaments. Superior and inferior articular processes form joints with adjacent vertebrae. C1 and C2, the first 2 cervical vertebrae are specialized to allow for the movement of the head, Atlas supports the skull and allows nodding motions. Axis has a projection called the dens, which allows for rotation. Image 7. Vertebrae types and characteristics. Cervical vertebrae, the smallest and lightest vertebrae. They have transverse foramina, small holes for vertebral arteries, and their spinous processes are bifid. Thoracic vertebrae, larger than cervical vertebrae, they have facets for rib attachment. Their spinous processes are long and point downward. Lumbar vertebrae, the largest and strongest vertebrae. They bear the most weight and have short, thick spinous processes. Image 8. Sacrum and coccyx. Sacrum, a triangular bone formed from 5 fused vertebrae. It connects the spine to the pelvis. The sacrum has several key landmarks: sacral promontory, the top part of the sacrum that connects with L5. Sacral foramina, openings for nerves and blood vessels. Coccyx, the tailbone, formed from 3-5 fused vertebrae. It is a vestigial structure, meaning it no longer serves the original function. Image 9. Regional characteristics of vertebrae. This table compares cervical, thoracic, and lumbar vertebrae. Key distinctions include cervical vertebrae, small body, triangular vertebral foramen, and bifid spinous processes. Thoracic vertebrae, heart-shaped body, circular vertebral foramen, and long, downward-facing spinous processes. Lumbar vertebrae, massive kidney-shaped body, triangular vertebral foramen, and short, blunt spinous processes. Image 1. Thoracic cage. The thoracic cage protects the heart and lungs and consists of the sternum, ribs, and thoracic vertebrae. Sternum, the breastbone, a flat bone located at the front of the rib cage, composed of 3 parts: manubrium, the uppermost part, where the clavicles and the first ribs attach. Body, the central, long portion to which the majority of ribs attach. Xiphoid process, the small, pointed cartilage at the bottom of the sternum, which ossifies in adulthood. True ribs, these are the upper 7 ribs, and each connects directly to the sternum via its own costal cartilage. False ribs, ribs 8-10 connect to the sternum indirectly via the cartilage of the rib above. Floating ribs, these ribs do not connect to the sternum at all and are shorter. Image 2. Rib articulation. This image shows how a typical rib attaches to the vertebrae at the back. Head of rib attaches to the body of a thoracic vertebra. Tubercle of rib articulates with the transverse process of the vertebra. Shaft, the long, flat part of the rib. Costal groove, found along the inside of the rib, it protects nerves and blood vessels. This structure is critical because ribs must move during breathing, expanding and contracting the thoracic cage as the lungs inflate and deflate. Image 3. Review sheet. This is a set of review questions on the vertebral column. Let's break down some of the answers. 1. Cervical vertebra. This refers to vertebrae in the neck region that have holes in their transverse processes to allow arteries to pass through. 2. Axis. C2 vertebra allows for rotation of the head, thanks to a unique structure called the dens. 3. Thoracic vertebra. These vertebrae have processes that articulate with ribs and point sharply downward. 4. Sacrum. This is a large, composite bone formed from the fusion of 5 vertebrae, and it articulates with the hip bones. 5. Lumbar vertebra. Large, weight-bearing vertebrae found in the lower back. 6. Coccyx. The tailbone, formed from fused vertebrae, doesn't have a major function in humans. 7. Atlas, C1 vertebra, which supports the head and allows for nodding motions. Image 4. Vertebral structures. This section covers the key structures of the vertebrae: body, the large, weight-bearing portion of the vertebra. Spinous process, the bony projection off the back, which muscles attach to. Intervertebral foramina, openings between vertebrae where spinal nerves exit the spinal column. Vertebral arch, the structure encloses the spinal cord. Image 5. Thoracic cage. Some questions regarding the thoracic cage: true rib versus false rib. True ribs connect directly to the sternum via their own cartilage, while false ribs either connect indirectly or not at all. Thoracic cage shape. The thoracic cage is roughly conical, expanding outward from top to bottom to accommodate the lungs and heart. Image 6. Herniated disc and spinal curvatures. A herniated disc occurs when the nucleus pulposus protrudes through the annulus fibrosus, often compressing spinal nerves and causing pain. This is common with age or injury. Image 7. Fetal skull. This image shows the differences between a fetal skull and an adult skull. Frontanels, soft spots in the fetal skull where the bones haven't yet fused. These allow for compression during birth and brain growth during infancy. Anterior fontanelle, the largest, located at the top of the skull. Posterior fontanelle, found at the back of the skull. These areas eventually ossify as the child grows. Image 8. Appendicular skeleton overview. The appendicular skeleton includes the bones of the limbs and the bones that attach the limbs to the axial skeleton. It's essential for movement and flexibility. Image 9. Fetal skull review questions. Fontanelles. These are soft regions in a newborn's skull that allow for a movement during childbirth and brain growth in early life. Craniosynostosis, a condition where one or more of the fontanelles close prematurely, which can affect brain growth. Image 10. Thoracic cage review questions. From this review focus on identifying different parts of the thoracic cage and understanding the role of different ribs in protecting the organs of the chest. Pectoral girdle. This image covers the bones that make up the shoulder, focusing on the clavicle and scapula. 1. Clavicle, the collarbone which connects the arm to the body. Acromial end. This connects to the acromion of the scapula, forming the acromioclavicular joint. Sternal end. This connects to the sternum, near the jugular notch. 2. Scapula, the shoulder blade which sits at the back of the rib cage. Spine, the prominent ridge on the scapula. Acromion, the highest point of the shoulder where the clavicle connects. Glenoid cavity, the shallow depression that connects with the humerus. Coracoid process, a small hook-like projection that helps anchor muscles. The shoulder girdle is designed for mobility and flexibility, with the clavicle acting as a brace for the arm. Image 2. The arm, forearm, and hand. This section breaks down the arm and hand. Arm, the single bone of the upper arm. It fits into the glenoid cavity of the scapula at the shoulder joint. Anatomical neck, separates the head of the humerus from the rest of the bone. Surgical neck, a weaker region that is prone to fractures. Forearm, consists of two bones, the radius and the ulna. When the hand is in anatomical position, the radius is lateral, and the ulna is medial. Hand, carpals, the 8 bones in the wrist. Metacarpals, the 5 bones that make up the palm. Phalanges, the bones in the fingers, with 3 per finger, except for the thumb, which only has 2. Image 3. Bones of the hand. This figure highlights the bones of the right hand. 1. Carpals, 8 bones that form the wrist, arranged in 2 rows, proximal row, scaphoid, lunate, trichetrum, pisiform. Distal row, trapezium, trapezoid, caput, hamate. 2. Metacarpals, numbered I to V, starting from the thumb side. 3. Phalanges, each finger has 3 phalanges, proximal, middle, and distal. This image also compares the bone structure with an X-ray view of the right hand. Image 4. Pelvic girdle. This shows the structure of the pelvic girdle, which supports the weight of the upper body and connects the spine to the lower limbs. Ilium, the broad, fan-shaped part of the pelvis. Ischium, the lower, posterior portion, which supports body weight when sitting. Pubis, the anterior part of the pelvis, which connects to the other side of the pubic symphysis. Each of these bones fuses together to form a large, solid structure that is crucial for movement and weight bearing. Image 5, Table 10.3, Pelvic girdle. This table provides descriptions of the major parts of the pelvic girdle: iliac crest, the top, curving edge of the ilium. Greater sciatic notch, a deep notch that allows nerves and blood vessels to pass through. Ischial tuberosity, the roughened area where your weight rests when sitting. Pubic crest, a ridge of bone along the interior of the pelvis. Acetabulum, the deep socket that holds the head of the femur. The pelvic girdle has to be large and strong to support the weight of the upper body and the forces generated by walking or running. Image 6, Bones of the foot. The foot is made up of tarsals, 7 bones that form the ankle and back of the foot. The largest is the calcaneus, which bears much of the body's weight. Metatarsals, 5 bones that form the sole of the foot. Phalanges, bones of the toes, arranged similarly to the fingers, with 3 bones per toe. The arches of the foot allow the foot to bear weight and act as a shock absorber. Image 7, Review Sheet, Pectoral Girdle and Upper Limb. This review sheet helps you test your knowledge about the bones of the shoulder and upper limb. 1. Pectoral girdle, consists of the clavicle and scapula. 2. Upper limb, formed by the humerus, radius, and ulna. 3. Wrist bones, the proximal row and distal row. Image 8, Pelvic girdle. This review sheet is for identifying and understanding the bones of the pelvic girdle. True pelvis versus false pelvis. The true pelvis lies below the pelvic brim, containing the pelvic organs, while the false pelvis lies above it. The sheet also has a diagram of the hip bone, which helps you label key areas like the acetabulum, iliac crest, ischial spine, and pubic symphysis. Image 9, Review Sheet, Pelvic and Lower Limb Bones. This sheet tests your knowledge on the bones of the hip and lower limb. Femur, the thigh bone, longest and strongest in the body. Tibia, the shin bone, which bears the weight of the body. Fibula, a thinner bone on the lateral side of the leg, providing some support. Patella, the kneecap, which protects the knee joint.